Hello, my name is Dr. Alyssa Swick. I am a general pediatrician and one of the co-medical directors of the Diabetes Youth Foundation of Indiana. We are so excited to have you coming out to camp and volunteering with us this summer. We hope it will be an educational experience for you to learn more just in general about taking care of children, but specifically taking care of children with type 1 diabetes as well. A little bit of background. I have been involved in camp for almost 25 years, first as a camper. I have type 1 diabetes myself, and then as counseling staff and as volunteer medical staff. And now I've been in this medical director role with my co-medical director, Joy Matuszak, for several years. We are both so glad to have you coming out to camp. We truly could not do our programming without you. And we are really lucky to get to serve and help educate a lot of young campers this summer. So we're going to dive right in. This video should be relatively brief, and we'll talk about camp policies and a little bit about our electronic medical record that we use at camp. So first things first, welcome to medical staff orientation. This is kind of the first portion. We do ask that you review each of the uploaded YouTube videos on our channel in order to just get basic understanding that kind of augments what you can read and understand from the manual. In these videos, we're going to kind of hit hard the really important things that you really need to know in order to be able to go to camp and function as volunteer medical staff successfully. So there are several videos that we ask you to watch. This is general policies. There's a video on pumps and sensors. There's a video on managing hyper and hypoglycemia, a video on adjusting insulin, video on the camp infirmary, and then also a video on dietary management at camp. We will have Zoom sessions, which will be interactive Q&A and kind of some of the diabetes math that plays in just to practice that before you actually get to camp and are practicing on real people. So we will talk through all of that together on those Zoom sessions. Those will be led either by myself or one of our other lead medical staff. So we look forward to talking with you there. Those are required. If you are not able to participate in one of those sessions, you do need to email me and we can set up a time to do some back and forth discussion one-on-one or with others if needed. And then on site at camp on your arrival day, you'll arrive at camp around 9 a.m. You'll have some time to get settled and go to your cabins. And then at 9:30, we will meet as a group with your lead medical staff who will be with you that week. And then all of the other volunteer medical staff, and we'll go through a little bit more hands-on training and also get some hands-on practice using the electronic medical record. We hope that the EMR will not be intimidating. It is really tough to practice using it when you don't have patients or campers that are kind of logged in. We don't have that capacity until camp is getting ready to start. And so while we would love to go over camp views more thoroughly with you prior to the start of camp, it is most functional for us to do it this way. Okay, so first off, who works at camp? So DYFI is a 501c3 organization. We have a board of directors who are kind of behind the scenes. You won't see, although many of us who work at camp also serve on the board. And then we have 3 staff members who are with us, some full-time and some part-time. Our executive director is Jenna White. Our developmental director is Emily Butera, and you'll see both of them at camp relatively regularly. Our program director is Alex Hunter. And then we also have staff that come in just for the summer. So programming staff that teaches courses like arts and crafts or nature or our lifeguards. And then we also have counselors who are kind of the primary people leading campers during their week at camp, and junior counselors who support the counseling role, but then also do other kind of support work around the camp, like helping in the kitchen, cleaning, making kind of all the things tick and run at camp. And then we have lead medical staff who, like myself, are either general pediatricians, family doctors or our nurse practitioners who may also work specifically in the diabetes field or in primary care or emergency care. And so we, all of us kind of dedicate our time year after year. Most of us have been coming to camp for quite some time, and all of us have lots of experience taking care of just diabetes in children, but then also just medical care for children as well. And then yourself, you are the cabin medical staff or volunteer medical staff. So you will be kind of living with the campers and the programming staff during your week at camp and with them all the time helping manage their diabetes. A little bit more about our lead medical staff. So I mentioned we have kind of the two main medical staff that are either physicians or nurse practitioners. We also have a infirmary nurse, which you can kind of think of as like the charge nurse for the week, who again is experienced at being with us at camp. And many of our nurses have been coming for even decades in some cases, who basically help run the show and make sure that anyone who's sick or hurt or needs a Band-Aid is taken care of. They also help us dispense controlled substance medications, treat minor injuries, along with the lead medical staff. We really are able to treat a lot of medical needs at camp outside of diabetes. So many of our campers have other chronic medical conditions like asthma or allergies that we take care of. And you will help us with some of that as well with managing some of those common chronic issues of childhood with our support by, providing medications as prescribed by the campers, PCPs, et cetera, and dispensing those at camp. But then also, kids get hurt and staff get hurt. And so the medical staff is there to really treat whatever is needed. Certainly we have our limitations. I cannot take care of a broken bone or somebody who needs IV fluids at camp these days, but we can kind of triage effectively and get you to a higher level care if needed. And there's a lot that we really can do and manage effectively on site, which is good because it helps keep people at camp and enjoying their week of fun, even if they are a little bit under the weather. We also have a lead dietitian with us every week. And then most of the time we have a pump specialist as well. Typically the pump specialists are only at camp like 8 to 5, Monday through Friday. And they help us make sure all of our site changes are happening in a timely fashion because most of our campers are wearing pumps and CGMs. It is a lot for just the lead medical staff and infirmary nurse to manage. And so that pump person really helps take the burden off. All right, couple important camp rules. There are a lot of camp rules in your manual, and we will go over camp rules as well on site, but these are the things that you really need to know before you show up. So camp is smoke and alcohol free. Please do not bring tobacco products, vapes, any type of smoking paraphernalia with you to camp. This is an environment where we want to focus on taking care of children. And so we do not allow smoking on our campus, and we do not allow alcohol at all on our campus either. Cell phones are permitted. Obviously, it's challenging in the day-to-day world to not have your cell phone. We all recognize, right? Like, I have 2 kids. I'm not going to not have my phone with me in case of emergency while I'm at camp. However, it is important that we try to keep camp a cell phone free as much as possible experience for our campers. Some of your campers will have cell phones that are brought to camp to serve as one of their diabetes devices. All of these are placed on airplane mode and need to be left on airplane mode throughout the duration of camp. We do not allow campers to use our cell phones, and we also do not allow campers to kind of have possession of their cell phones to use in that capacity either, only to be used for diabetes management. And really, we encourage use of an actual diabetes device instead if possible, just because, there's a lot of rocks and bumpy things at camp, and we never want a phone to be broken or injured. There's an entire policy on this that is in your camp manual that I would encourage you to read. We'll talk again more about this in person. We do not have routine laundry service at camp. We do have the kind of small capacity to do laundry with a bed that's been wet or a camper who gets all of their clothes muddy and needs something as backup. However, the expectation is that we're not doing laundry routinely during the week. So bring extras. You should anticipate that there will be variation in the weather. June is often a very rainy month in Indiana. So come prepared, with a variety of clothing options. I would bring some pants, some shorts, some, sweatshirts, something that's going to keep you warm, and something for warmer weather as well. And then also make sure that you have at least two changes of closed-toed shoes, because we do things like creek walks, and you will get messy. So bring extras. Err on the side of a little bit more is probably a good idea. Many people ask if we have caffeinated beverages at camp, and we certainly do. We have coffee in the dining hall. It is not Starbucks. It is from a coffee maker made with camp water. And then we do offer a soft drink for all of our campers and our staff between 3 to 4, Monday through Friday. If you cannot make it through the day without something specific, you can bring food and drink with you, but it needs to be consumed not in front of campers, and it needs to be kept in your own personal space. Okay. What do you need to bring to camp? So at camp, we have bunk beds. We try as much as possible to have our medical staff on the bottom bunk, since most of us are a little bit older than many of our camp and programming staff, but also because you're going to be waking up overnight to manage blood sugars, usually at least once or twice overnight on the first couple of days, and then perhaps a little bit less frequently after, to manage diabetes overnight at camp. And so you will need to bring the bedding that you choose to sleep with. The mattresses are twin bedding size. So if you prefer to bring a fitted sheet and a blanket, that's fine, or a sleeping bag and pillow, whatever your preference is. We don't have a ton of extras of these at camp, so please bring the bedding that you desire. We'd encourage you to bring a refillable water and coffee container. We recommend against bringing bottled water, especially in large volumes. There's just not a lot of places to put it or store it. We do have water available at camp. So bringing a refillable container for that is helpful. We usually also have like a Crystal Light of some variety, just because the water doesn't always taste as bottled as some of us might like it to. So bringing something that you can put a beverage in, whether that's water or Crystal Light, is a good idea. Again, rain gear is important. Anticipate that you will get wet. We do not go inside and stop activities unless there is thunder and lightning. So we will continue our play outdoors as much as we can. And so being prepared for rain is important, whether that's a poncho, a rain jacket, an umbrella. Just make sure you come prepared. We are in the middle of the woods, and so insect repellent is encouraged. You will need towels and washcloths for both showering and then also for swimming as well. Toiletries, whatever you prefer to use at camp is fine, but shampoo, soap, that sort of thing. I would suggest bringing a couple of masks to camp as well. We don't have a requirement this year for COVID vaccination. Certainly COVID numbers do look better, but we have had outbreaks at camp in the past, to the point that we actually had to cancel a week of camp a couple of years ago because we had so many staff who got sick that we weren't able to operate. And so, any shared living environment certainly carries risks. We encourage you to be vaccinated to reduce your risk of illness at camp, although that is not one of our required vaccines. But I would bring a few masks just in case. As medical staff, if your campers are sick, you will be helping us care for them. And certainly we will encourage masking of anyone who is sick as well until we screen and make sure that's not what's going on. But it's just a good thing to come prepared with. Definitely want to bring a jacket or sweatshirt so that you are not cold. And then you will need daytime clothes and pajamas. I would recommend at least one pair of pants, maybe more, depending on what the weather looks like for your week. There often is a lot of variation. So you might kind of start the day in long pants and long sleeves and then end up in shorts and a tank top as the day goes on. And then also we do require longer pants for some of our activities, like high ropes, which you'll have the opportunity to do. And then also it's just generally a good idea to wear longer pants when hiking to reduce plant and insect exposure. We would recommend hard-soled shoes or boots for hiking, and then at least an extra pair of sneakers or hard-soled water shoes for a creek walk. If you prefer to wear water shoes, that's fine, but you want to make sure they have a hard sole on the bottom because there are rocks, etc. We do tie-dye each week at camp. You will get a colored medical staff shirt on your arrival so that parents can identify you at check-in and check-out as one of the medical staff at camp. Our campers, we give white t-shirts and they tie-dye those. So you will not get a white shirt to tie-dye. So if you'd like to tie-dye while you're at camp, bring a white shirt or something white so that you can participate in that with your campers. And then we also recommend bringing a swimsuit and towel. We do have a pool and campers go to the pool daily as long as weather allows. Okay, so what should you not bring? So we recommend against electric fans because they can short circuit our electricity. Our camp is old. And we have a lot of things that need to be charged these days, from iPads for our EMR to campers' diabetes devices. So we want to use our electricity responsibly. So fans are not advised. Curling irons, straighteners, blow dryers, you just don't need them. So would recommend against bringing those. And then again, no alcohol, no tobacco, no vaping products, and no e-cigarettes. That is a hard no. If we find those, we'll have to have a serious conversation about that. And typically we'll ask you to leave. So please do not bring those to camp. And then also no weapons. Camp is a weapon-free zone. So do not bring your gun, do not bring a taser, do not bring pepper spray or knives onto our facilities. And then this is kind of an awkward thing to talk about, but we want to make sure that we're wearing clothing that's appropriate to be taking care of children. So one of the biggest things that people ask is like, can I wear a two-piece swimsuit? That's totally fine. But just for some examples here, remember, you're going to be in a pool with kids who are rough and tumble and playing. So, we try to be gender equitable. So for men, I would recommend, longer swim trunks, nothing that's super short. And then for women, just kind of remembering that things do get pulled and tugged. If you want to wear one piece just to make sure you're covered, that's fine. You can wear a bikini if you'd like. That the black and blue one that is featured has a little bit more modest coverage. I would really recommend against anything that's strapless or the high cuts, just because I think you're going to be uncomfortable and less likely to want to play with campers. And then, kind of extracting from that modern fashions, certainly, wearing a sports bra is fine, but we do want to have, a t-shirt or a tank top over that, avoiding having see-through clothing. So this person who's stretching before their run, this is a good example of what would be fine. So athletic wear, totally fine. You don't need to come in a suit and tie. Just make sure that it's appropriate wear for being around kids. If you have questions about what you can and cannot bring, again, feel free to shoot me an email. Okay, I want to mention a couple pieces about just preventing transmission of illness at camp. So first things first is universal precautions. Certainly, we are not in a hospital setting, we're not in a clinic setting, but we are still dealing with healthcare. And so we always want to practice hand hygiene. And so you will have antiseptic gel available in your ammo can, which is the container that your campers will carry around. That kind of carries their diabetes management supplies, but you can also keep extras of that in your backpacks if you'd like to in the cabin as well. So there will be plenty of antiseptic gel. And then there are hand washing stations at the dining hall, in the infirmary, in the bathhouse, kind of as needed. We also always, of course, want to make sure that we're washing hands before we are eating. But then, if we're checking a blood sugar with a finger stick, or we're doing a diabetes site change, something like that, we want to wash our hands before that time as well. We recommend that you use gloves for any or all procedures that have potential exposure to blood or bodily fluids. So most of the time, you are not going to be the person who is doing anything with like needle exposure unless you're helping a child give a injection. Most of our campers, again, are wearing pumps and CGM. So the frequency of this is small, but we do have some campers every year who are still using pens or syringes. And so certainly if you would like to wear gloves for that, we would encourage that. There are gloves in the infirmary, backpacks, and cabins. So always accessible. There's usually a couple of pairs that are included in all of those spaces. If you need more, we always have those available at the infirmary. Kind of to this point, again, all of our site changes are done by our lead medical staff, just because when you haven't been exposed to those things, there's a lot of different options in diabetes management. And so it's hard to teach you all of them, but we do encourage you to kind of come with your campers, watch, participate, and learn in those environments. But we'll always be there to support and supervise those site changes. So with that in mind, we're going to talk about sharps. And the reason we have such a high emphasis on this is because we have needle sticks relatively frequently at camp, because there are a lot of needles in diabetes management. So we have a very firm policy on sharps management at camp. Anytime there is a sharp that is in use, the camper needs to dispose of that sharp, and it always should go in a sharps containers. So we'll encourage you to carry a backpack, and you should keep a small sharps container in that at all times. There's a list here of kind of what goes in a sharps container. We'll get to that in a second. There are also bigger sharps containers, because some of our like pump site change materials don't necessarily fit in the smaller ones. So if you have something that doesn't seem like it fits into the sharp, don't ever push or shove it. Come to the infirmary, the dining hall, or the diabetes education porch and dispose of it there. And when we say come, we mean send your camper to do that, because you really should not ever be disposing of a camper sharp. We all, I think, especially in healthcare, want to help, but this is not an area where we want you to help your camper. This is something that they should be doing independently. Do not recap sharp devices. Say that again. Do not recap sharp devices. If there is something like a pin, there are ways, and we'll practice this at camp, to remove those without recapping. And then also, again, this is always something where the camper only should be doing this. So really, if they need help giving an injection, that's fine, but then we are handing that pin or syringe back for the camper to dispose of. We do use single-use retractable and disposable lancets at camp. If your campers come during check-in and they have with them a lancet device, the answer is no, you may not leave that with you. So many of us have diabetes at camp. There's too high a risk of accidental use of someone else's needle. And so we do not allow for reusable lancets at camp. Each camper uses individually labeled pens and vials, and these are very clearly labeled. Again, we'll go over this at camp. And then this is kind of a weird one that you may not know about, but cotton balls or alcohol swabs that are contaminated with blood must be disposed of in the sharps container. Okay, anything that is contaminated with blood. So if we're putting gauze on an injury, if we take off a Band-Aid and that has blood on it, that should go in a sharps container as well. If you are using an alcohol swab just to clean, that can go into the trash can. But if you're using it to wipe away blood, sharps container. We are not concerned about the volume of stuff we're putting in sharps devices. So don't need to worry about conserving space. We have plenty of containers. And if you have questions, again, about what can and cannot go in the trash versus the sharps container, please ask. This is often something that campers are not used to doing consistently at home, but home and camp are not the same. And when we're managing multiple people's diabetes, we do have to be more careful to reduce risk of injury and also practice universal precautions. If you have soiled linens, so for example, a camper has a urinary accident, a stool accident, something like that, those linens should be put into a plastic bag. There are trash bags in all of the cabins for transport to the laundry room, and then we will help manage that in the infirmary. The laundry room is actually a part of the infirmary. So if something needs to be washed, come see us in the infirmary. All right, if you have a needle stick, first off, there's a policy for this in the manual. Please read it, the whole thing, but these are the highlights. So if you are stuck with a needle or exposed, the first thing you want to do is cleanse the area immediately with soap and water. If you have something that is in your eyes, or if you have like a blood splatter, something like that that's in your eyes, we do have eye solution in the infirmary for an eye rinse. We immediately want to notify the camp director or the lead medical staff so that we can walk through the procedure with you and make sure that we are screening for any relevant diseases as needed. A formal report does need to be completed on this. And then you and the source, which usually is a camper, will be offered the option to obtain antibody tests at your preferred lab. There is follow-up required for needle stick exposures, and this can be done with your primary care physician or using the National Clinicians Post-Exposure Hotline. We will help you navigate all of this if it occurs. We would love to have a needle stick-free camp this summer, so please, please, please make sure you're being aware of sharps. Never handle a sharp that has been in another person's body. That person can handle it themselves. Even if it is a child in a camper, we can teach them to do that safely, and it is far safer for them to do it than for you to do it. All right, so what are you going to do as medical staff at camp? First off, a lot of your job is going to be documentation. So we are providing healthcare at camp, and so we have to make notes on all of the things that we're doing. So things that we're going to document in the EMR, and again, we'll show you what this looks like in that virtual Zoom session, and then also on site. Anytime we're eating carbs, that goes in the EMR. Anytime we're checking our blood sugar, that goes in the EMR. Now, your campers may be on a CGMS that is checking blood sugar every 5 minutes. That doesn't need to be written down, but there will be key times, right? Before meals, always written down. Before moderate or high intensity activities, always going to be written down. And then before bedtime and snacks as well. And then overnight, we'll talk about that later in orientation too. Anytime you give insulin, it goes into the electronic medical record. Anytime you give a med, it goes into the electronic medical record. And then also anytime a site is changed. So really anytime you're doing something for diabetes management for a camper, it goes into the EMR. We want to be mindful and make sure that we are checking blood sugars before each meal and before bed, and then any other time a treatment decision is made. So we don't go off of how a camper is feeling. If a camper comes to you and says, I think my blood sugar is low, I'm going to eat some carbs, the answer is, well, why don't we check your blood sugar, right? Either by looking at a CGMS or doing a finger stick, following our hypo and hyperglycemia protocol. Again, this might be different from how some of your campers manage their diabetes at home. And this is an opportunity to provide education and help them kind of change their best practices as they manage their diabetes moving forward. We are going to assist campers with calculating insulin doses and insulin administration. And we're going to observe all insulin administration regardless of how it is done directly. So that means if a camper is giving insulin on their pump, they're giving a bolus of some kind, they are never to do that without showing it to you first. Now, we know that there are going to be times where just out of habit, right, they're going to do it themselves, especially in older campers. We can help you learn to go back and look at insulin, but we also want to create the habit of asking them to show it to you before they do it. A nice way to do this is to say, hey, I'm learning. I need you to show me so that I can understand better how to manage diabetes. So help me learn by showing me what you're doing. And then we also are going to observe all site changes. Many of your campers may do this independently at home. That's great. We're still going to watch them do it at camp. Again, because we want to make sure they're doing it correctly. We want to make sure that they are keeping their skin clean and using good precautions to prevent infection. But then also, a lot of times they're doing it wrong. And this is a good opportunity for us to teach and help them take better care of themselves at home. All right, you're going to monitor for signs and symptoms of high and low blood sugar. Again, there's a whole video on this. We're going to meet daily to review campers' glucose trends and what we're doing for them. So this is your responsibility with your partner medical staff in your cabin to find the lead medical staff that you are assigned to each day by dinner time to kind of sit down and round or staff. You can call whatever you'd like. This is relatively informal, but it is a good idea, especially as the week goes on, for you to have kind of looked through and thought, are we doing well, or are there things that we might need to do differently? And we would love to hear you kind of propose solutions, and we will help you brainstorm things to make sure that we are keeping your camper safe and preventing low and high blood sugars at camp. It is your responsibility to restock the ammo can and backpack with all necessary supplies. So we would suggest at least every morning and every afternoon checking in. Anytime you're going to be leaving the main area of camp is also a good time before you do that to check and make sure you have everything that you need. And then we want to keep camper medications locked in the MedStuff boxes at all times. So you'll have a lock box that you can keep non-diabetes meds in. And then any controlled substances, so like ADHD medications, stimulants, that sort of thing, are going to go in the infirmary, and those are only given and dispensed by lead medical staff. You will get an alert on the kind of medical overview for your campers if you're getting a med that is a controlled substance. And then once you collect that medication at check-in, you will give that to one of the lead medical staff and we'll get that locked up. Okay. You should stay with your group at all times. The exception to that is each day we have med staff education between 9 a.m. and 10 a.m. That is usually done behind the dining hall. But if there is weather, we will choose a different location. And there will be a schedule for this in your manual. You should also work with others in your group to arrange coverage so that you can do self-care things, right? So we don't expect you to work 24/7, but somebody needs to be available and with your campers 24/7. Meal times are not the time to step away because that's a high kind of intensity period where you're helping a lot. But during cabin activity time or during nature or diabetes education, actually diabetes ed isn't a good one from an activity standpoint because oftentimes that's a good time for you to learn too. But there are times during the rotation of the day and you can help kind of with your other medical staff figure out when a good time would be along with your programming staff, that it would be fine for you to take a break, take a shower, take a rest, or make phone calls as needed. Sometimes we do have volunteer medical staff who have requirements for schoolwork that they need to complete during their experience with us. We don't have general camp Wi-Fi, but we do have hotspots that you can check out from the infirmary. We are in a remote location and we're on a large area. So especially because we are using Wi-Fi for our electronic medical record, we want to try and be mindful about not putting too much stress on that. So anytime you need to get on the internet for some reason, please come to the office/infirmary and we can help with that. You should sleep in your assigned cabin. You might be in a different cabin than your assigned group, depending on gender distribution. So we sometimes have female medical staff who are with our male campers during the day, and we'll talk about logistics of that when you're on site. In case of an emergency, your uncle dies, your dog is having a seizure and it needs to go to the vet. We know that these things happen. So please let lead medical staff know as soon as possible so that we can support you and find coverage. Ultimately, that's our responsibility. We ask that you not abuse that, right? We know that camp can be challenging. We appreciate you hanging in there for the week with us because it's a good experience. But if you're really having a difficult time or you have something emergent that you need to attend to, we want you to let us know so that we can make accommodations and make sure that people are safe. What we do not want you to do is leave camp without telling us, because then we're going to worry, like, are you lost in the woods and we need a search party type of thing. For any emergencies, you will have a radio in your ammo can, and that is how you should contact lead medical staff. If you're right outside our door, come knock and come into the infirmary. But if you are anywhere else, please radio us because we will have radios accessible at all times and overnight. Sometimes people try to use cell phones for this. Cell phone service is unreliable at camp. Sometimes it works and sometimes it doesn't. And texting is not a HIPAA secure option. So anytime you need us emergently, that needs to be done over the radio. And we'll practice that at camp. All right, so CampViews is our electronic medical record. It is an EMR that's built specifically for diabetes camps and from one of our partner organizations. And so it is a little bit clunky, but it is better than hauling paper around and shuffling through. Again, we will do on-site training for CampViews at camp, and then also you'll get a little bit of a preview into what CampViews looks like during that Zoom orientation question and answer session. Okay. This is a picture of the creek at camp and some of our campers enjoying walking through there. If you have any questions, please feel free to send me an email. It's alyssadswick@gmail.com. And I look forward to seeing all of you in the upcoming Zoom Q&As and at camp this summer. Thanks. Bye.